My name is Adam Shanley. I'm from Dublin in Ireland, and I guess I am a Irish HIV prevention activist. So I work in a number of different capacities, both in the community in an outreach capacity with the Gay Men's Health Service, which is Ireland's longest running and only statutory national service for men who have sex with men and the trans population. On a wide range of things, and PrEP being one of them. I'm working then also with government and the HSE, which is our National Health Service. In Ireland at the moment we have more new HIV infections than we've ever had. For the first time in 2015 we went over 500 new infections, and that trend is consistently on the rise. Men who have sex with men are disproportionately affected by HIV in Ireland, with over 50% of new HIV infections being attributable to MSM. And it's something that's kind of really fallen off the radar in terms of, you know, a national discussion. It's not really in the narrative of our country in terms of sexual health and well-being, and so much has changed in Ireland recently. I mean, in 2015 we had a landslide victory in terms of marriage equality, and then most recently this year having a referendum on access to abortion, which again is a huge landslide. So there are conversations about sex and sexuality happening, but HIV still seems to be one that, you know, the country doesn't seem to engage in. And we have this incredible tool that can prevent HIV, and people seem to be dragging their feet. And when I say people, the politicians, the decision makers, the policy makers in Ireland don't seem to be engaging with something that we know can stop the huge trend of new HIV infections in Ireland. I mean, you know, 518 new HIV infections last year, like higher than the height of the AIDS epidemic, and yet it's not getting anywhere near the discussion it needs.